You have been handed a prescription. Maybe it was your first one for blood pressure, or maybe it joined a handful you already take every morning. The doctor was kind, the appointment was brief, and as you walked out with that little slip of paper, a quiet question lingered in the back of your mind. Is this really the only way? I am Dr. Naira Stein. I have spent many years working alongside older adults who are navigating exactly that question. People who want to take their health seriously, who are willing to do the work, but who suspect that what they put on their plate every day matters far more than anyone has taken the time to explain to them. And they are right. What I want to share with you today is not advice to stop taking your medication. Please hear that clearly. What I want to share is the evidence. Solid, peer-reviewed, carefully documented evidence that certain foods contain compounds so biologically active, so specifically targeted at the mechanisms that drive high blood pressure, that they can produce measurable changes in your numbers in ways that sometimes rival or meaningfully complement pharmaceutical treatment. These are not exotic ingredients. They are not expensive supplements. They are foods that most of us have seen our entire lives, perhaps without ever understanding the extraordinary chemistry happening inside them. Stay with me. By the end of this conversation, you will have a clear, practical, science-backed plan you can begin tonight. Before we get to the 5 foods, I want to give you a foundation. Because when you understand what is actually happening inside your blood vessels, the reason that food can be so powerful will make immediate, intuitive sense. Blood pressure is essentially a measure of how hard your heart must work to push blood through your arteries. When that pressure is consistently too high, it places mechanical stress on artery walls, strains the heart muscle, and over years quietly damages every organ the blood touches: the kidneys, the eyes, the brain, and the heart itself. There are 3 primary biological mechanisms that drive most cases of high blood pressure in older adults, and understanding them is key to understanding why specific foods work so well. The first is vascular stiffness. As we age, the smooth muscle inside artery walls gradually loses its elasticity. Arteries that were once supple and responsive become stiffer and less able to expand when the heart pumps. This rigidity raises pressure. Many blood pressure medications, calcium channel blockers and ACE inhibitors, for example, work specifically to counteract this stiffness. So do several of the foods we will discuss today. The second driver is sodium and fluid balance. Your kidneys regulate the amount of fluid in your bloodstream, and sodium is the primary signal they use to make that determination. When sodium is too high, the kidneys retain more water, blood volume increases, and pressure rises. This is why salt restriction is one of the oldest and most consistent recommendations in blood pressure management, and why potassium-rich foods, which signal the kidneys to release sodium, are among the most effective dietary interventions known. The third driver is inflammation and oxidative stress. Chronic, low-grade inflammation damages the endothelium, the thin cellular lining of every blood vessel in your body. When the endothelium is inflamed, it produces less nitric oxide, a molecule that naturally relaxes and widens blood vessels. Less nitric oxide means tighter vessels and higher pressure. Several of the foods we will cover today are exceptionally powerful at reducing inflammation, protecting the endothelium, and restoring healthy nitric oxide production. Now you can see why food reaches blood pressure so directly. It is not magic, it is biochemistry. The right foods contain compounds that act on these exact same mechanisms, sometimes through pathways that are remarkably similar to the drugs prescribed to manage them. Food 1. Beets, nature's nitric oxide pump. If I could choose one food to recommend to every older adult with elevated blood pressure, beets would be a very serious contender. The research behind them is some of the most compelling in the field of nutritional cardiology. Beets are extraordinarily rich in dietary nitrates. When you eat them, bacteria in your mouth and enzymes in your digestive system convert those nitrates into nitric oxide, the same molecule your endothelium is supposed to produce naturally, but often cannot produce in sufficient quantities when inflamed or damaged. Nitric oxide works by signaling the smooth muscle in artery walls to relax. When those muscles relax, the arteries widen. When arteries widen, resistance drops. When resistance drops, blood pressure falls. It is a direct, elegant, beautifully simple mechanism, and beets deliver it in quantities that researchers have found genuinely striking. A landmark study published in the journal Hypertension found that drinking approximately 250 milliliters, roughly 1 cup, of beet juice daily produced an average reduction of around 8 points in systolic blood pressure and 4 points in diastolic blood pressure within just 24 hours. In people with hypertension, the effects were even more pronounced. To put those numbers in perspective, a reduction of 5 systolic points is associated with a meaningful decrease in the risk of stroke and cardiovascular events. A reduction of 8 points begins to approach the effect size of some first-line antihypertensive medications. And this was achieved through food, not pharmaceutical chemistry. Beets can be eaten roasted, steamed, grated raw into salads, or blended into a morning juice or smoothie. Beet juice is the most concentrated source and produces the fastest results in research settings, but whole beets provide the added benefit of fiber, which supports gut health and blood sugar regulation. One important note: avoid using antibacterial mouthwash immediately before or after eating beets, as it kills the oral bacteria responsible for the first stage of nitrate conversion. That simple habit change can meaningfully preserve the blood pressure benefit. Food 2. Leafy greens. Potassium in its most powerful form. Most people know vaguely that potassium is good for blood pressure. What most people do not know is just how profound that relationship is, or how dramatically most older adults are falling short of the potassium intake their cardiovascular system actually needs. Your kidneys operate on a continuous balancing act between sodium and potassium. When potassium rises in the bloodstream, the kidneys respond by excreting more sodium, and with that sodium, excess fluid. Less fluid in circulation means lower blood volume. Lower blood volume means less pressure against artery walls. The effect is real, measurable, and begins within hours of a potassium-rich meal. Beyond fluid balance, potassium also directly relaxes the smooth muscle in blood vessel walls, working through a mechanism that complements and partially overlaps with the effect of certain blood pressure medications. This is not coincidence. It is the body using the mineral it was designed to receive in abundance from a plant-rich diet. While bananas are often cited as a potassium source, leafy greens, spinach, Swiss chard, kale, romaine lettuce, and arugula deliver potassium at significantly higher concentrations relative to their calorie content. A single cup of cooked spinach, for example, provides well over 800 milligrams of potassium. The recommended daily intake for blood pressure management is around 4,700 milligrams, an amount that becomes entirely achievable when leafy greens become a daily fixture. Leafy greens are also rich in dietary nitrates, the same nitrate pathway that makes beets so powerful. Spinach, arugula, and Swiss chard are among the highest nitrate-containing vegetables known, which means they support nitric oxide production and vascular relaxation at the same time as they rebalance sodium and potassium levels. They are doing two jobs at once. Large observational studies, including data drawn from the DASH diet trials, one of the most rigorous dietary investigations of blood pressure ever conducted, consistently show that people who eat the most leafy greens have the lowest blood pressure readings and the lowest rates of cardiovascular disease. In the DASH trials, a diet rich in vegetables, particularly greens, reduced systolic blood pressure by an average of 11 points in people with hypertension. That is a clinically significant reduction by any measure. The goal is at least 2 generous servings of leafy greens per day. This does not require elaborate cooking. A large handful of spinach wilted into morning eggs, a salad at lunch, steamed chard alongside dinner, any of these count. Frozen spinach and kale retain most of their nutritional value and are often more affordable and convenient than fresh. The consistency matters far more than the preparation method. Food 3. Oats. The slow, steady pressure reducer. Oats tend to get discussed mostly in the context of cholesterol, and while their effect on LDL cholesterol is indeed well documented, oats carry a separate and equally compelling benefit for blood pressure that receives far less attention, particularly for older adults. The active compound responsible for most of oats' cardiovascular benefits is a soluble fiber called beta-glucan. This is not the same as ordinary dietary fiber. Beta-glucan is a viscous, gel-forming substance that does something quite remarkable as it moves through your digestive system. When beta-glucan reaches your gut, it becomes food for beneficial bacteria, specifically strains that produce short-chain fatty acids during fermentation. These short-chain fatty acids, particularly one called propionate, travel through the bloodstream and interact directly with receptors in the walls of blood vessels. The result is measurable vasodilation, a relaxation and widening of the arteries that occurs through a pathway entirely distinct from nitric oxide. Oats are essentially working through a gut vascular axis that science has only recently begun to fully appreciate. A meta-analysis examining multiple controlled trials found that regular oat consumption produced a reduction of approximately 3 points in systolic blood pressure and 2 points in diastolic pressure. Those numbers may sound modest in isolation, but they represent population-level risk reduction that is genuinely meaningful, and they are achieved without side effects, without cost, and without any change to existing medication. Beyond the direct vascular effect, oats stabilize blood sugar by slowing glucose absorption after meals. This matters for blood pressure because blood sugar spikes trigger a cascade of hormonal responses, including cortisol and adrenaline release, that raise blood pressure temporarily. In people who experience these spikes repeatedly throughout the day, the cumulative effect on blood pressure is significant. A breakfast built around oats flattens that curve from the very first meal. Rolled oats and steel-cut oats preserve the most beta-glucan and deliver the slowest, most stable glucose release. Instant oats, particularly flavored varieties with added sugar, have been processed in ways that reduce both the fiber content and the blood sugar benefit. Plain rolled or steel-cut oats, prepared simply and paired with a small amount of healthy fat, such as nuts or seeds, represent one of the most powerful cardiovascular breakfasts you can build. Add a handful of the blueberries we have discussed in previous sessions, and you are combining multiple protective mechanisms in a single meal. Food 4. Garlic, one of the most studied foods in cardiovascular medicine. Garlic has been used medicinally for thousands of years across nearly every culture on Earth. For a long time, modern medicine dismissed this as folklore. Then, researchers began studying it seriously. What they found has quietly reshaped our understanding of what food can do. When a garlic clove is crushed or chopped, an enzyme called alliinase converts a compound called allein into allicin. Allicin is unstable and short-lived. It begins breaking down within minutes. But in that brief window, it is remarkably biologically active. It stimulates the production of hydrogen sulfide gas inside the body, which acts as a powerful signaling molecule that relaxes blood vessel walls and promotes vasodilation. It also inhibits an enzyme involved in angiotensin production, the same pathway targeted by ACE inhibitor medications, one of the most commonly prescribed classes of blood pressure drugs. Additionally, allicin and its derivative compounds reduce the stickiness of platelets in the blood, improving flow and reducing the resistance that contributes to elevated pressure. And garlic carries significant anti-inflammatory properties, protecting the endothelial lining of blood vessels from oxidative damage. A comprehensive review of clinical trials examining garlic supplementation found average reductions of around 8 systolic points and 5 diastolic points in people with elevated blood pressure. In some individual trials, particularly those using aged garlic extract, reductions exceeded 10 systolic points, a threshold that approaches the effect of a single antihypertensive medication at standard dose. These findings have held up across multiple research groups, different garlic preparations, and a range of patient populations. Garlic's effect on blood pressure is not a fringe claim. It is one of the most replicated nutritional findings in cardiovascular research. The key to maximizing allicin production is to crush or finely chop garlic, and then let it rest for 10 to 15 minutes before cooking or eating. This rest period allows the alliinase enzyme to complete its work. Adding garlic directly to a hot pan without this rest reduces allicin formation significantly. Let it sit, then cook gently. Raw garlic, stirred into salad dressings, hummus, or yogurt-based sauces, preserves the most allicin of all. Aged garlic extract supplements are a well-researched alternative for those who find raw or cooked garlic difficult on the digestive system. They lack the pungent smell, but retain most of the cardiovascular active compounds, and have been specifically studied for blood pressure in several high-quality trials. 2 to 4 cloves of fresh garlic daily, or an equivalent supplement, is the range that most research has validated. Food 5. Berries, the anti-inflammatory shield your arteries have been waiting for. We have talked about blueberries in a previous conversation in the context of eye health, and the mechanism behind their benefit there. Anthocyanins, the deep pigments that act as powerful antioxidants, applies just as directly to blood pressure. But the berry family as a whole deserves a place in this conversation because the evidence for their cardiovascular effect is broad, consistent, and growing. Anthocyanins, found in blueberries, strawberries, raspberries, blackberries, and cherries, protect the endothelium, that critical inner lining of every artery in your body, from oxidative damage. A healthy endothelium produces nitric oxide freely and continuously, keeping vessels relaxed and open. An inflamed or damaged endothelium does the opposite. It constricts, stiffens, and eventually contributes to the structural changes that make hypertension progressively harder to control. By reducing inflammation and oxidative stress in these vessel walls, anthocyanins restore something closer to the endothelial function of a younger cardiovascular system. They literally help your arteries remember how to behave. And because the endothelium is the common thread connecting virtually every mechanism involved in high blood pressure, improving its function has effects that ripple across the entire system. A large-scale study that tracked nearly 35,000 women over 14 years found that those with the highest anthocyanin intake, primarily from blueberries and strawberries, had a 12% lower risk of developing hypertension compared to those with the lowest intake. In controlled trials, daily blueberry consumption has been shown to reduce systolic blood pressure by an average of 5 to 6 points over 8 weeks in people with elevated readings. Separate research has found that strawberries specifically improve endothelial function, as measured by flow-mediated dilation, a clinical test that evaluates how well arteries expand in response to increased blood flow. In people with abdominal obesity, a group at particularly high cardiovascular risk, strawberry consumption produced statistically significant improvements in this measure within weeks. Fresh berries are wonderful, but frozen berries, picked at peak ripeness and flash frozen, retain their anthocyanin content extremely well and are often far more affordable, especially outside of summer months. A cup of mixed berries daily is a realistic, sustainable, and evidence-backed target. Add them to oatmeal, blend them into a smoothie, or eat them as an evening snack. The flexibility of berries makes them one of the easiest of these 5 foods to build into a consistent daily habit. Part 8. How to put all 5 together. A practical daily framework. Knowing about 5 powerful foods is one thing. Knowing how to actually weave them into your day in a way that feels natural and sustainable is another. Let me offer you a simple framework. Not a rigid meal plan, but a set of anchors that make these 5 foods easy to include consistently. A breakfast of rolled or steel-cut oats topped with a generous handful of mixed berries gives you 2 of the 5 foods before your day has properly begun. Add a sprinkle of ground flaxseed or a few walnuts for healthy fats and additional omega-3 support. This meal stabilizes your blood sugar from the first hour of the day, supports your gut microbiome, and begins the anti-inflammatory work that will continue through every meal. Lunch is the ideal time to anchor your greens. A salad built on a base of spinach or arugula, a grain bowl with wilted kale, or a simple soup with Swiss chard stirred in. Any of these delivers your potassium and dietary nitrates at the meal when your digestive system is most active and ready to absorb them. If you prefer a hot lunch, a quick sauté of garlic and spinach in olive oil achieves 2 foods at once and takes less than 5 minutes. Dinner is the natural home for garlic, crushed and rested before being added to almost any savory dish, and for beets, which can be roasted in a batch at the beginning of the week and served as a side throughout. A small glass of beet juice in the late afternoon, about an hour before dinner, is a simple practice that research has specifically shown to produce measurable blood pressure reduction within hours. When these 5 foods appear daily, even in modest amounts, they begin to work together in ways that exceed the sum of their individual effects. Nitric oxide production is enhanced. The potassium-sodium balance shifts toward lower pressure. Inflammation in vessel walls is reduced. The gut microbiome is strengthened and becomes more efficient at extracting cardiovascular protective compounds from everything you eat. The effect compounds quietly, day after day. I want to return to something I said at the beginning, because it matters greatly. If you are currently on blood pressure medication, please do not adjust or discontinue it without speaking to your doctor first. What these foods can do is meaningful, but they work best as part of a complete approach that includes regular monitoring, open communication with your healthcare provider, and an honest conversation about how your diet is changing. Some patients I have worked with have, over time and with their doctor's guidance, been able to reduce their medication as their diet and lifestyle improved. That is a real possibility for some people. but it is a process that should be supervised, gradual, and based on consistent blood pressure readings, not a decision made independently after a week of eating oats and beets. The goal is not to replace medicine with food. The goal is to give your body every advantage it deserves, and then let the results speak for themselves. Part 9. What amplifies these foods? The lifestyle layer that multiplies every benefit. No food works in isolation. The 5 we have discussed are remarkably powerful, but they work within a larger biological context, and certain habits either amplify or undermine everything good nutrition is trying to do. I want to briefly address the ones that matter most for blood pressure in older adults. During healthy sleep, blood pressure naturally dips by 10 to 20%, a period of cardiovascular rest that allows the heart and vessels to recover from the demands of the day. People who do not experience this nighttime dip have significantly higher rates of heart attack and stroke. Poor sleep quality, whether from insomnia, sleep apnea, or chronic stress, removes this protective window and keeps the cardiovascular system under sustained pressure. Prioritizing 7 to 8 hours of quality sleep is not optional for blood pressure management. It is foundational. Regular physical movement, and it does not need to be intense, trains the cardiovascular system to operate more efficiently. Walking in particular is extraordinarily well studied for blood pressure. A consistent daily walk of 30 minutes has been shown to reduce systolic blood pressure by 4 to 9 points over weeks of regular practice. The mechanism is straightforward. Regular movement stimulates nitric oxide production, reduces arterial stiffness, and trains the heart to do its work with less effort. Walking costs nothing, requires no equipment, and works beautifully alongside every food on this list. Chronic stress keeps cortisol and adrenaline elevated for hours at a time. These hormones constrict blood vessels, increase heart rate, and raise blood pressure, sometimes dramatically and persistently. Over years, chronic stress contributes to the structural stiffening of arteries that makes hypertension progressively harder to control. Deep breathing exercises, gentle yoga, prayer, time in nature, or simply a quiet and intentional evening routine, whatever form stress reduction takes in your life, it directly supports every food-based intervention we have discussed today. Every single day, 3 times a day, you make decisions that are directly shaping the pressure inside your arteries. Not in some abstract, distant way, but through specific, measurable biological mechanisms that scientists have now studied in remarkable detail. That is not a burden. That is an opportunity. The 5 foods we have covered today, beets, leafy greens, oats, garlic, and berries, are not a trend or a theory. They are supported by decades of research, thousands of participants across dozens of clinical trials, and mechanisms that are now understood at the molecular level. They work. They are safe. They are affordable. And they are available in every grocery store. I want to encourage you to start with one. Just one. Add beets to your dinner this week. Make oatmeal your morning anchor. Crush a clove of garlic and let it rest before your next meal. Notice how simple it feels. Then add another, and another. Small changes made consistently accumulate into a cardiovascular environment that genuinely supports a long, active, and independent life. I am Dr. Naira Stein. Thank you for investing this time in understanding your own health. Your body has an extraordinary capacity to respond to good care, at any age. The science confirms it, and you deserve to know it. Take good care of yourself. I will see you in the next one.